Cool. Yes, we are live. Great. There are people. That's awesome. So we can get started. I just want to say a quick intro remarks to kick us off this evening before our amazing panel talks to us about this important issue that's happening all the time, but particularly during COVID. So I'm Lauren. I'm on the UDC Executive Board, and I work on some of the events that we've been having during this crazy time. And we are so excited to be partnering with SFWPC on this important issue that affects a lot of people, but particularly women. And if you want to learn more about us, follow us on social, get involved at iadms.org, and continue to show up and learn about all the amazing things that our teams are putting together while we're at home on Zoom, learning things on the webinars. So with that, I'll have Sharon Chung from WPC tell a little bit about your organization and the work we all do together.
Hi, everyone. Thank you so much for joining us this evening. We're so excited to be partnering with United Democratic Club on this very important panel. My name is Sharon Chung, and I'm the events chair for the San Francisco Women's Political Committee. We're the largest women's organization in San Francisco with the mission to engage female identifying individuals in all dimensions of the political process and to increase awareness for the women's issues that affect families and children all across San Francisco. You can find out more information about how to join and become an SFWPC member at sfwpc.org. And now I will turn it over to our lovely moderator, Jarlene Choy, to start our programming for tonight. Thank you.
Jarlene, we can't hear you.
There we go. Okay, I've unmuted myself. So thank you United Democratic Club, SF Women's Political Committee, our panelists, and everyone, all of you, for showing up tonight, especially after a full day of work for many of you, on such an important topic that is domestic violence. So we're really excited to hear from you, your questions, and tonight we'll learn about how COVID is impacting domestic violence survivors, as well as what are policymakers and community-based organizations doing to support survivors, and also what resources are available to directly support survivors, but also friends, family, and colleagues who want to support survivors. So to briefly share my connection to the issue, I previously worked at Futures Without Violence, which is a national gender-based violence organization based here in San Francisco. And it was one of the lead organizations in helping to draft and pass the historic Violence Against Women Act of 1994, which was sponsored by Biden. So this act, VAWA, was historic in that it first defined and established domestic violence and other forms of sexual violence as federal crimes. And this was only less than 30 years ago, mind you. And it also created the first dedicated federal funding stream for rape crisis centers, as well as expanded services for supporting survivors. So it's a very important piece of legislation in the history of domestic violence. And currently, VAWA is being reauthorized, or, well, it's up for reauthorization at the Senate. So I encourage all of you to contact your senators following this panel as a call to action. And so specifically during COVID, to set the context, shelter-in-place orders were instated to flatten the curve and protect everyone's public health. However, for domestic violence survivors, this means that they are further isolated in their homes with their abusive partners. And so home for them is one of the most dangerous places to be. And also during the pandemic, we've seen surges in gun purchases, and this is due to many factors, but research has shown that abusive partners who have access to firearms, in these situations, women are 5 times likelier to be murdered. So the connection between gun violence and domestic violence is very clear. And so that's why gun violence prevention organizations like Giffords, where I work, this is an organization that was formed by Congresswoman Gabby Giffords, who's a gun violence survivor herself. We've been working with lawmakers and law enforcement to make sure that laws are in place to strengthen laws during this time, especially to protect survivors. So before we move to our panel, I'd like to remind everyone to be mindful and respectful of survivors that may be on our call tonight. So when you're using the chat box, thank you, Sharon, for typing in the hotline for anyone who needs it. And also, given the topic, if you need to take a break from the call, please do what you need to take care of yourselves tonight. And with that, we'd love to better understand who's on the call tonight. So we'd love our audience to just take 10 seconds into the chat box. Please share if you feel comfortable, if you're an advocate, a policymaker, or if you identify with another type of role. And then second, please type in one takeaway that you'd like to get from tonight's call. So if everyone can do that now, that would be wonderful. Okay, so I don't see any chats. Does anyone see any? Okay, there's someone who typed, "Hi, Marquita." Yeah, this is just a way for us to make sure that what we're sharing tonight is useful for you. So if you'd like to share throughout the call something you'd like to learn from tonight, please do. And this will help us better serve you. So thank you for joining us again, and let's meet our panelists. And let's first have Akiko introduce herself, and then we'll go by alphabetical order by first name. Akiko?
Hi, thank you very much for putting this panel together. So my name is Akiko Takeshita, and I work as a managing attorney at Asian Pacific Islander Legal Outreach. We provide legal services to San Francisco County and Alameda County, several other counties, depending on our funding. DV, domestic violence and family law are major projects within our office. And I'm happy to be on this panel because there are some challenges under the COVID stay-at-home orders. The courts have been open for emergency orders like domestic violence orders, but I don't think a lot of people were aware of that. I know for our office, we're physically closed, but our phones are open and our emails open. And we didn't really get a lot of calls like in March and early part of April. However, I mean, I don't know, good news, bad news is we're getting a lot of calls now. Good news in the sense that people are reaching out. Bad news is the sense that there's a lot of calls. I think we got 2 restraining orders today. I just saw one of my team members. So we're getting, I would say, almost double the calls under normal times. So it just kind of goes to show you that the need is still out there. I don't know if it's just been bottlenecked, but the courts are open. And that's the one thing that I guess is a silver lining, that we're able to still get orders to protect people through the civil courts. However, as I'm sure everybody will touch upon, it's still a really hard time, difficult time for a lot of domestic violence survivors right now.
Thank you, Kiko. Nicole?
Good evening, everyone. It's a pleasure to be here. My name is Nicole Lindler, and I'm the policy advisor for Mayor Breed on domestic violence. I'm also the vice president of San Francisco Women's Political Committee. And I'll just say that we are so thrilled to have this topic tonight because it is so important. We know, as Jarlene said, that not everyone is safe sheltering at home in place. And I'm excited to dive into that, into this topic about what we're doing for survivors here in San Francisco.
Thank you. Orchid?
Hi, everyone. My name is Orchid Pusey. I am associate director. I was associate director for a long time. I still don't say executive director at Asian Women's Shelter here in San Francisco. And I've been there for 18 years. We're a program that does all sorts of direct service, crisis support work, case management, and longer term change work, as well as community-based cultural change and systems advocacy work. I'm so glad you're all here today.
Thank you. And Sonya?
Hi, everyone. I'm Sonya Passi. I am the founder and CEO of FreeFrom. We're a national organization actually based in LA. And our work is working to dismantle the nexus between domestic violence and financial insecurity. We know that the #1 reason survivors stay in and return to abusive situations is financial insecurity, not being able to afford safety. And so everything that we do is with a lens to how do we build an ecosystem to support survivors' long-term safety, long-term healing, and through that, how do we break that generational cycle? And just everything is sort of operating from the standpoint that we end domestic violence by investing in survivors.
Thank you. So just a reminder to all the audience members, feel free to submit your questions through the Q&A, and Sharon will save those for the panel, the Q&A that will start around 6:10. But for now, we'll start with the panel. So first off, Orchid, what is domestic violence? What does it look like? Who experiences it? And what are some of the obvious and not so obvious warning signs?
Sure. So I'm going to go through this quickly. And so I just want to start with a message for everybody that this is going to be fast, like sort of panel style. This is heavy stuff that I'm saying really quickly. I would normally not give a laundry list of these things to anybody's ear because it's hard and it's real. It's so far from some strange esoteric topic. It's people's lives. And so I want to apologize for the manner, but give you the content. So domestic violence, in a really blunt form, domestic violence is a pattern. It's not a one-time thing, even if you're seeing it for the first time, or even if it shows up physically only one time, it's about a pattern visible or invisible to outsiders. The pattern has coercive control at the center of it, of a person or a family, or a person and their family and their congregation, or a person and their family and their whole community colluding in controlling somebody else or a whole family. And the tools that are used to maintain that coercive control over somebody range a lot. And so, you know, as people have already said in the chat box, you already know, it's not just physical violence. Physical violence is obviously a part of domestic violence, and the physical violence has a range in and of itself, from property destruction and vandalism all the way through feticide, child homicide, adult homicide, elder homicide, self-harm, the threatening of self-harm. So it's a wide range that we're talking about. And then when we look at other tools to maintain that coercive control and hold the reins on somebody's life, there are other tools. So of course, emotional abuse and psychological abuse are harder for some in our communities to wrap their minds around, but are absolutely part of domestic violence no matter what. Destroying somebody's relationships with the people that matter to them, their family, their friends, their children, that is another tool. Creating an environment of isolation, of financial control, running up somebody's debt, getting a credit card in their name and running it up. Making sure that someone can't manage their own finances, making sure that someone doesn't have control over any money in the household. Those are all other examples of tools of domestic violence. And I think overall, creating an environment where a survivor knows every day that they're oscillating between different levels of dread and horror that someone else controls, and that the weather of their life is set by somebody else. That person sets the tone of the day, they set the tone of dinner, they set the tone of the summer, they set the tone of everything. And their emotional state defines the state of everybody else. Everybody else's safety, their ability to sleep that night, their ability to make choices about their own lives. Usually, of course, the last thing I'll say is that really, if your sense of control and stability comes from dominating someone else, you're going to use everything that you have. So there's no sort of exhaustive list of the tools of domestic violence that we memorize. It's not like that. It's more that we look at the social context around us all the time and look at imbalances of power all the time everywhere, because those are the same imbalances that will be used in domestic violence. So in many cases, we'll see people using social power to dominate. So if one person speaks English and the other doesn't, if one person has immigration status and the other person doesn't, if one person isn't out, that can be used against them. If one person feels under great threat, if police are anywhere on site, that's going to be used. People will also go the opposite way, though. It's not just someone with social power who is committing domestic violence. It's also people with a lot of social vulnerabilities who are committing domestic violence. So someone might be just as likely to use their social vulnerability to manipulate as someone would use their social power to dominate. So we look out for all of those dynamics, and domestic violence, I'll say, happens to everybody. It's just that it's exacerbated by different things in different communities. But it's certainly not that sort of the root cause is systemic oppression, given that we have people in the highest echelons of the 1% who absolutely have domestic violence going on. But of course, systemic oppression exacerbates. In terms of warning signs, the last part of your question, I would say that, you know, there are usually the signs, the domestic violence develops over time. It's not like the first time you meet someone, you know, there's like humiliation of you, shutting you down, much less physical violence on your first date. Obviously, that's not how it happens. It's usually quite insidious. And the warning signs are hard to believe, especially if social conditions and social norms have trained you to question your intuition, to question your read, and to think that you should put up with quite a bit to get any kind of positive attention or protection. So some of the warning signs that I talk about most frequently are things like, you know, if early on you can see that if something happens and the other person wasn't consulted or they weren't part of the decision-making process, that somehow turns into a big thing. Like somehow that is always going to become a big thing. That can show up earlier than someone, you know, burning something that matters a lot to you. Obviously, there's going to be some time span that happens between those two types of actions. If somebody never takes responsibility for themselves, if somebody always has sort of their primary emotion in the world is anger first, or their primary sense of themselves is a victim, they're always the victim of everything. Everyone is always trying to shut them down. Ironically, that is a very, very common early sign of someone who abuses, is someone who thinks that everything is against them and they need to fight for their survival. And in that story, they are never responsible for any condition they live through or any action they take.
Thank you, Orchid, for that very comprehensive answer. And I know there's a lot to cover and it can be very heavy. And so I noticed in the chat box that we have some mental health workers, some social workers. We also have some survivors on this call. And so, Orchid, if you could also share, are you hearing anything different from survivors about what they're experiencing during COVID?
I think with regard to COVID, the main thing I'll say is just like it's like anything else, it's an exacerbator. So anytime you have increased stress, increased fear, increased job insecurity, increased vulnerability socially, increased anxiety, the domestic violence that was already there is going to get worse. And so we've definitely heard that. We had originally at the very beginning, you know, people have access programs in different ways. So of course people have less access to privacy. So just to reach out for help is harder. There are fewer ways to reach out for help. People who normally would go to their parents, who have supportive parents, that's lucky already, or people who have a supportive neighbor or supportive friends are much less likely to think that that is a continuing resource, or they know directly that it's not, or they make the choice themselves because their parents are elderly and they're not going to bring other risks into their family's house in addition to the sheer risk of being a survivor of domestic violence who runs to somebody else's home. So the calls that we've been getting, they ramped up in the very beginning. We had a lot of calls from immigrant and refugee survivors who are living in the intergenerational households where literally everybody is under more stress. And the person at the bottom of the ladder who bears the brunt of everyone else's emotional, who takes all the responsibility for their well-being and has none of the authority, is calling and feeling like they don't know how to survive. The compilation of pressures in addition to the increased intensity of the control and the violence. So I think that it's a combination of the intensity going up inside and the loss of resources outside that has made for a very tough situation. And then there are survivors who are trying so hard to get free, who have already been in contact with one of us, with one of our programs, or one of the many other programs, and they just got that first job. They just got that first paycheck that they controlled. They have their own bank account, and that got lost during COVID, that they are at the bottom of the hiring tiers. They're the first hours to get cut, the first job to get cut maybe. And so they're facing exactly what Sonya's working on, is back to that intersection of, do I land in another situation, which is my only source of economic survival? Do I go back to the bad one because it might be a source of economic survival? So those are all really active situations survivors are facing.
Thank you, Orchid. So with all of the unique challenges that you shared that COVID has been presenting, I'd love to hear from Nicole, what elected officials, how they're responding, and also what is being done here in San Francisco.
Yeah, definitely. So as I said, we know not everyone is safe sheltering in place. And even before that, on a yearly basis, the city has been very committed to helping domestic violence survivors and resourcing organizations that do this work. Currently, we provide about $9 million in grants to 26 community-based nonprofit organizations that provide these type of critical services to youths and adults that, like Orchid said, are experiencing some type of domestic violence, stalking, intimate partner violence, etc. And these organizations really act as a conduit to our crisis lines and for intervention and advocacy. Most definitely, they are providing legal services and helping to do some work in prevention along with education. But particularly during shelter in place, we've had to ramp up support. We all know that there's been an increase in calls to SFPD. There's been an increase in calls to some of the hotlines that our partners have and are running. And so we know that we needed to increase kind of what we were doing. So one of the things that we've done is that we launched text to 911 over shelter in place, which was kind of groundbreaking in San Francisco. We didn't have that before. And particularly we did that because of domestic violence, because we know that sometimes it's way too dangerous to dial 911. And we want to make sure that survivors have that option. Of course, anyone can use that option, but when we launched it, it really was with domestic violence in mind. Secondly, another thing that we did was that we secured 20 furnished apartment units for survivors, because we know sometimes when you have to get out of that situation, if you have nowhere to go, that just keeps you trapped. And we don't want survivors to feel like they have nowhere to go. So we were able to do that. And of course, we're hoping to add more. We can all agree that 20 is probably not enough, and we're going to try to ramp that up. And then recently, The mayor released a public service announcement on family violence, which incorporates kind of domestic violence, but also child abuse and other types of intimate violence. And I thought that was a really bold statement to come out and do a public service announcement and say, here's how you can find the resources that we have in San Francisco. And no one should be afraid to ask for help. Like, we are here for you. We will provide you with the resources. Please call. Please do not wait a minute longer. We've also held a town hall with our Department of Status of Women on this topic. And we are in the process currently of putting up posters around San Francisco that's going to have all the domestic hotline information along with family violence resources, so that anyone who's experiencing that, they'll easily be able to hopefully see those numbers. And we're going to do it at places where we know survivors frequent, like grocery stores, banks, laundromats, etc. And then the last part of your question was what's being done to protect survivors. So our domestic violence crisis hotlines, they've remained open. They continue to support callers and provide resources, which we're grateful for. They are essential workers in that sense. And our service providers, they've really adjusted their platforms so now that they're able to go virtual and provide these services to vulnerable populations. So that's been awesome. And we've also relied on organizations such as, the ones on this panel, of course, but then also Bay Area Legal Aid for their legal advice line to get survivors connected quickly to support. And even before shelter in place, I had the pleasure to work on an app that we launched in the Bayview. We put on every officer's phone to be able to do a lethality assessment when officers are on the scene and they're answering a survivor's call. They ask them a set of questions and they assess right then and there, what is the risk for this person? And if they score a certain amount, they are telling them, you need to go. We will connect you to resources tonight. You do not have to wait a second longer, because we know that every second a survivor waits could possibly turn into a deadly situation, and we don't want that.
Thank you, Nicole. So I know we have so many questions and so little time, so I want to make sure that all of our panelists have an opportunity to share. So Sonya, could you share a little bit more about what your organization is doing responding to the economic insecurity during COVID? And then I'd love to ask Akiko about legal resources.
Yeah, absolutely. So 2 big things that we've done. The first is we launched the Survivor Safety Fund about 2 months ago to get cash directly to survivors who need it. It was a rapid response fund. We started to raise the money and then started giving it out as soon as we had it. We have been able to get almost $270,000 to 1,100 survivors in small grants of like $250. And that money, people are most commonly saying they are using that money to buy food, and that is their most urgent financial need right now. And although we made kind of the application process very simple, we also asked people if they had a minute and their application wasn't contingent upon it, to answer a couple of questions for us so that we could really hear directly from survivors what they need right now. And a couple of things that we're learning. The average dollar amount that survivors are saying they need in order to stay safe is $745, which, when you think about the grand scheme of philanthropy and how much it costs to solve systemic problems, that's nothing. The top 3 needs that survivors have are cash to spend as they need it, utility bill relief, and credit and debt relief. We're hearing, like Orchid said earlier, exacerbated financial abuse. A lot of survivors not getting access to their stimulus checks as a result of that financial abuse. And then I think one of the things that Orchid touched on that's really important to remember is typically domestic violence, we address domestic violence as a crisis, but all that really means is that we as a society only really pay attention to domestic violence once it reaches that point of such acute crisis. But more likely than not, that person has been experiencing that for potentially years beforehand. And And so, you know, people were looking to see if domestic violence incidents were going to rise during COVID, but what does that really mean? It doesn't mean that people weren't experiencing this at great numbers before, and maybe their situation hasn't changed at all during COVID, but it doesn't mean that it isn't dire. And I'll give you an example that we heard from a survivor. She had planned that this was going to be the year that she would leave. And what she was doing was she was saving money. She would, when her harm doer went to work, she would bake. She would go out and sell what she baked, pocket that money, and her harm doer was none the wiser. And she had mapped out how long it was going to save her enough to be able to get out and not have to come back. And so she wrote to us and said, what this means is it's going to be probably 2021 before I leave. And really just thinking about what does it actually look like to be a survivor, and what is needed to really support someone in getting out in a way that feels right for them, or staying but making the best of the situation that they can. So that was the big thing that we did, was a safety fund. And the other piece was we created a COVID response guide for everyone to know what they can do to disrupt intimate violence. And it's available on our website, and it has tips for employers, for community members, for banks, for city, state, federal governments, for hospitality and lodging industries, for religious organizations and churches, because this is a systemic problem. And our responses to date have been Band-Aids. And what it will really take to end domestic violence is every single pillar of our society taking accountability for their piece of it, employers, banks, et cetera, et cetera. And really, I think we have a window of opportunity here during COVID, while people are essentially experiencing firsthand what it's like to feel trapped in your home, and that expanding the ability to empathize for what it must be like to live like that and live with added dangers on top of that, to really get some real change on the books, and to really galvanize all of that interest and the interest of people that have joined us today, and people asking, what can I do? I think we have a real moment here during COVID to make sure that when COVID is over, survivors aren't still trapped because we didn't do anything to support them during this time.
Thank you so much, Sonya. It's really encouraging to see how rapidly your organization and others have been responding in very innovative ways and getting cash directly to survivors. And so, Akiko, could you briefly share some of the legal resources? And then we'll take one more question, and then we'll go to Q&A.
I think we're fortunate in California, as well as in the Bay Area, that domestic violence is taken seriously. And like Nicole said, there's 26 organizations that are funded in San Francisco. We're one of them. There's shelters that are available. There are social services that come with a lot of the shelters. We do legal services, and oftentimes I say, and I agree with everybody on the panel, is like domestic violence, by the time we hear about it, it's been happening for a really long time. And when they come, by the time they get to our office or any legal service group, they're kind of we're the last resort. I mean, for them to step out and be willing to challenge their partner or the bad actor in a court of law, that takes a lot of strength and a lot of, and we have to appreciate that. And so our services have to reflect that. And so in this COVID time, like I said earlier, we were really concerned because we were not getting calls, and some of our partners, we work closely with a lot of other domestic violence service providers, where they could be in the medical profession or the religious faith-based or schools or social service groups. And I don't know if it was just in the Asian Pacific Islander community or the immigrant population that they perhaps thought that everything was shut down. But like I said, the courts are open. We've been going to court regularly, I would say in the last 4 to 5 weeks, getting restraining orders, serving people, things like that. For those who are able to reach out, we also provide services like the VAWA, because like Sonya said, a lot of people won't leave because of financial, and that's true. But a lot of the people we see won't leave because they have children in common. they're concerned about custody, visitation, whatever. Immigration is a huge thing.
Yeah.
Not knowing their immigration status. And I would say a good percentage of people who come to us have immigration status. They just didn't realize it because either the bad actor was giving them information that, you know, they'll be deported or whatever, but they may have status. So, and we also take advantage of VAWA. We do VAWAs for people who are eligible for that. So there are a lot of remedies that a lot of people just don't know are available. So it holds them back from reaching out. And also, I think just knowing that there are groups of and organizations that are out there specifically set up to help people like that. That's the other part, is just trying to reach out. But Bay Area Legal Aid, they help. CROC is another clinic that helps. We do full representation and we do family law, but a lot of family law issues can be handled in a restraining order. So people don't understand that, so they do get scared about reaching out because afraid of losing custody of their, children might be US citizens, but they're not. The husband might be a US citizen, or their partner is a US citizen or green card holder and they're not. So those things all are obstacles, in addition to, being poor. And being poor just colors everything. It's not going to allow them to do a lot or feel that they have a lot of options. And so part of our job is to really work with a lot of groups in the community. And like I said, there are a lot of resources available in San Francisco. And so they could call any of us and we could give them information as we see what they need at the time. Like a lot of times when they call us, the first thing we ask is, are you in a safe place? Can we call you back? Things like that. Because if they're not in a safe place, the first thing we do is we're going to try to have them connect with an agency that could, do they need shelter? They may not need shelter, but if they do, do an assessment to make sure that they have everything that they need to support them as they move forward. And so, but like I said, legal services, we're usually the last resort. Just they're not going to just open the, yellow pages or whatever and just decide they're going to get a restraining order today. There's a lot of things that have brought them to that point.
Yeah, thank you so much, Akiko and Sonya, for speaking to how it takes a lot of courage and strength. And sometimes by the time survivors reach out to an organization, it's been years. And so how do we really help prevent that violence in the first place, right? How do we really support survivors sooner? And so, yeah, and Akiko, also thank you for mentioning about how immigration status as well as economic status also exacerbates these situations. So let's turn it over to Q&A. I've seen a lot of questions submitted. Thank you, everyone. Feel free to continue to submit them because I think we'll have time to address most of them. But one question I'm seeing a lot from our attendees is, what are some really practical ways that family and friends and colleagues, like Orchid mentioned, sometimes there aren't any family members here in the United States that are safe, that survivors can turn to. So what are practical ways that these other individuals who care about survivors, how can they help in a safe way that won't put the survivor at harm? So if each person can say one answer or just one person with 2 minutes.
I can launch in and get us started. I usually break it down into kind of what you can do for survivors in general, and then what you can do for specific situations. What you can do in general, I feel like, is 2 things. 1, donate. 2, raise your children and your friends' children with different cultural norms of how to collaborate, problem solve, share, etc. 2, for what you can do for concrete situations that you're overhearing, that you're connected to in some way. Those I usually break it down into kind of 3 summary things, like 1, emotional support, 2, safety planning, and 3, self-management yourself. On the emotional support side, I think for some reason we're not really trained growing up in in providing emotional support and being there with someone through the ups and downs, through their crises. And so, you know, we can learn about it. There are some that are really clear, like don't ask people why, a bunch of why questions. Why? Just avoid the whole word. And remind people of their strengths. If you don't know what to say that you don't know what to say, but you're right there. I'm right here. I'm going to stay right here. I'm going to keep listening. If I had a magic wand, I would wave it. What can I do? What do you want? What could I say? Do you want me to trash talk? I'm going to use cisgender men and women in my pronouns and descriptions. Do you want me to trash talk him right now? Because I can. And if you don't, then I won't. You know, check with them over and over about what they want and what would support them in that moment. Don't fly into your own emotions such that they overtake the survivor, and then you blink 2 times and the survivor is either retracting from you or calming you down. That's what we don't want. With safety planning, even in COVID, there's a lot of things that we can do, even though it might look a little bit different. But for some people, it doesn't actually look that different. But with safety planning, we don't normally say all of it publicly because we don't actually want all of it to be totally public knowledge. But there are ways, you know, sometimes what we're telling people is just when you back out of that fight, sometimes you get baited. You get baited into the big fight that then turns into something ugly. And you backing out of that isn't you giving up. Telling someone that you backing out of that is you protecting yourself, is you trying to avoid violence, which is not the same as like you can control it, so therefore if it happened, it was your fault. It's about you trying to control the conditions in any way that you can for your safety or your kid's safety or your pet's safety or your elder parent's safety. And then finally, for your self-management, I think the biggest thing we can do is take care of ourselves so we can last, because one of the core ways of isolation that people who abuse use is to break off relationships that are supportive. So we have to outlast that abuse. And that means we have to hold ourselves back. When we're tired, we start to victim blame too. When we're tired, we start to get mad that someone's not doing what we think would cause the quickest solution to our distress, or the distress that we see happening for the survivor, our friend or our family member or their kids. And one of the things that is really good for the mind to remember for ourselves is leaving is the most dangerous. Leaving, like, this survivor is not crazy. This survivor's hesitance is about absolutely statistically backed realities of what leaving is. It does better with a plan. And so understanding and supporting where they are takes some of educating ourselves, and then us getting support so that the next time they call, we don't avoid it just because we're too tired.
I just wanted to.
Oh,
no, sorry.
Yeah, so we'll go Sonya and then Akiko.
Okay. Just piggybacking off what Orchid said, I think, first of all, we all know someone who has experienced, is experiencing intimate partner violence. 1 in 4 women, 1 in 2 trans folks will experience it in their lifetime. Statistically, you know, at least one person, probably many people. And we are so trained to believe that what happens in our neighbor's home is none of our business. Or what happens behind closed doors is none of our business. We're so trained to understand intimate partner violence as a private issue. And so while we may know how to respond if someone is in distress, we sort of disassociate from that in the context of intimate partner violence. And the reality is, it is not a private issue. It is a structural, systemic problem in our society. When you're talking about levels of intimate partner violence at that 1 in 4, 1 in 2, this is a structural problem, just like racism is a structural problem. And so what we all, and I'm speaking for myself when I say this, I'm constantly, you know, that meme that keeps going around about thinking about the cop inside your own head. It's how are we all placing our judgments on what it is to be survivors, and how do we need to educate ourselves about why intimate partner violence and other forms of gender-based violence happen, and how survivors are bearing the brunt of the abuse and violence that is perpetuated in our society, and really making sure that we're educating ourselves to understand the problem so that we're not taking the easy way out, which is either to judge and shame survivors or to just ignore that they exist in the first place because it's none of our business.
Thank you, Sonya.
What I wanted to just interject is the thing that we all have to kind of remember is the essence of domestic violence is that there's this relationship between two people. And sometimes, pretty much in any kind of relationship, it could get very messy. And when it becomes a domestic violence situation, it's not unusual for our client to vacillate. You know, like, should I stay? Should I go? Should I stay? Should I go? And as a provider of services to that population, we have to be really careful not to blame and not to pressure, because it's like a lot of times I think, oh, this is a slam dunk legally, but I have to be sensitive to the fact that this is her life or his life, not my life. I have to figure out what's good for them and give them my opinion, but it is ultimately up to the caller or the potential client, how they want to carry out. And so a lot of times I'll get family or friends calling saying, well, why won't she go? And why don't you explain it to her so she'll get a divorce or she'll do this? And it's like, you know, it's ultimately her decision, his decision. Just be a really good friend, be a supporter, and kind of like what Orchid said, you're gonna have to try to outlast that period, because until that person is really ready to leave, it's really hard for us to really do good by that person by just trying to pressure them or, you know, make them feel that they have to make these certain decisions when they're not really ready to. And it's not unusual for them to come back and forth a couple of times. And I have to tell a lot of my newer attorneys is like, just close out the case. Don't make them feel weird. Just tell them that, you know, if they have any more questions or they change their mind, please call us back, and then just let them go. And, you know, if they come back, they come back and we revisit it. But it's you know, all relationships are messy, you know, so it's like you have to kind of always remember that at one time or even still, there's a lot of, you know, emotion, and part of it could even still be love. So it's very tricky.
Yeah, thank you so much for reminding all of us to withhold judgment and shame and withhold blame from victims. That is so important. And so there's another question about what are the first steps that a woman can take to safely get out of a domestic violent environment? And I know this might differ case by case, but are there some general advice that you might have?
I think there are some general things. I mean, I think that some of the most common ones that we talk about are just, you know, somehow getting your important documents with you, whatever ones you have access to, getting them. And if you're not sure when you're going to go and you don't want to pull them out of folders or places where it will be noticed, finding some way to take pictures with your cell phone and keeping those with you, or copies, you know. Other things are, you know, if people do leave, there are just some really important steps to take. So being connected to an agency so that you can make a good cause report if there are kids. There's so many ways that survivors' behaviors are criminalized. And one of them is, you know, if there are shared kids, that the kids are filed as missing, abducted children, you know, victims of child abduction. And if a report isn't made, you know, programs can help you do that so that you don't become then victimized by that part of our system. And then I think some of it is similar to, I mean, it's like emergency preparedness and natural disaster preparedness too. That is part of it. So if there's medications, if people have chronic illnesses or anything like that where they need access, for people who, you know, need like medications that are refrigerated, it gets really, really hard. But just remembering those things and having a plan around them is really important. That's sort of like really blunt, immediate material planning.
Thank you. Anyone else want to chime in? I think there's time for one more question. And I know we didn't get to all of them, but we will have a follow-up email with this recording and a list of resources, further resources that you can look into. So someone did ask about continuity of care for children impacted by domestic violence. I know we've been focusing more on the partner, but if she has children, what resources are out there?
I'm so glad someone asked about this, because I am going to say that this week I found out that our city funder for our children's program has cut all the shelter children's programs and will not be doing future procurement given COVID cuts. And that is devastating, and I want everybody to know it, and that our city has yet to find a way for children exposed to domestic violence to have an actual long-standing home in a department. So children, continuity of care for children is so important and so connected to those kids' lives and just to public health in general. So I guess I'll just say that there are children's programs that are in various community-based domestic violence programs out there. There is more and more research and more focus going to the impacts of violence on children and how to support schools and build allies in schools so that those kids, just as their non-abusive parent can get criminalized for their survival reactions to domestic violence, kids have the same thing happen with the behaviors that they exhibit in school. So there is a stronger connection now than certainly when I started. Sorry, my four-legged coworkers are trying to contribute. Let me just start with that and see if other panelists want to jump in, because I have talked a lot.
I was just going to add to that. Orchid is really talking about like the services that are available and what more needs to be done for kids. And then I think there's also this longer vision piece of, as someone who grew up in an abusive home, I didn't even begin to consider healing until I was living in a safe home. And that wasn't until I was an adult. And children in abusive situations don't get to heal until they get to safety. And so as we think about, when I talk about investing in survivors, if the non-abusive parent is able to recover and is able to create a safe home, then the children get to recover and heal from what they experienced and witnessed, and understand that what they experienced was not okay. And you have some chance of that healing being able to occur. And so when we think about how do we support survivors in creating safety, whether that's by staying in the situation but making it a better situation, or by leaving the situation, it costs money. Healing is very expensive. It is a privilege to get to heal. And so kind of, if we think about how we can support survivors in building that financial luxury of healing and really being able to do that for themselves and their family, it has that generational ripple effect.
Thank you, Sonya. I know that we have 5 minutes left, and I want to respect everyone's time. And thank you so much, everyone, for submitting your questions. So let's do a speed round. Let's start with Nicole. So if you could share one resource or one organization or one call to action that you'd like attendees to leave with and look into further.
So I would love it if all attendees, after this call, really utilize some of the resources that we're going to give you about the local organizations that we have here in San Francisco to support them. But more importantly, we do need the resources. We have to be honest about that, and we need your help and your advocacy to, also ask your state senators and representatives to really lean into the fact that we need more resources going towards domestic violence and survivors, and make it an issue that we all care about. This does affect all of the major issues and systems we can think about, from housing to the economy. I mean, these are all wrapped up in that. So make that case, write those letters, call, get involved in this work, because it's so important that we have you all as allies in this.
Thank you. Akiko, Sonya, and then Orchid.
I think it's almost akin to the Me Too movement, where Another area that I hear about is between a DV relationship is no one will believe you. And so I think we should all just as civilians or people in the community, just be aware that there is a little bit of that as well. If you see it in your own family dynamics, brothers, sisters, uncles, that people call it out and for what it is, because so much of domestic violence occurs behind closed doors, and it is a he said, she said, or he said, or whatever. So it is another area that we can help a survivor, is to believe them and respect their truth as far as what they see in their life. And I think that might also help some people come out as well.
Thank you. Sonya, you have like 1 minute or 30 seconds, and then Orchid.
Sure, I'll be super quick. I just copied and pasted our COVID response guide into the chat.
Awesome.
It's by no means comprehensive. It's a starting point, but I'd really encourage people to look at it and see what you can do in different capacities. Maybe you're a community member, a churchgoer, and also an employer. And what are the different ways in which you can show up for folks? There's also resources in there for survivors. Orchid talked a lot about safety planning to leave. And we cover kind of how to do some financial safety planning for yourself or with someone, that is looking to do that.
Thank you. And Orchid, close us out.
I'll say one, donate and make a lasting relationship with a domestic violence program in your area. We love being friends with you. Two is, with the kids around you, all the kids that are in your life in any way, teach a better way.
Yeah.
Don't tell a kid who's been hurt that they should try to avoid that other kid next time. That there's so many ways that we're taught to perpetuate this pattern, really insidious daily ways, and we can teach the exact opposite in the same daily way.
Great. So I'll end with one other resource for anyone who's a colleague and you're worried about a colleague who may be in a domestic or a violent relationship. Workplacesrespond.org is really good, and they, I'll share it out in the email, but it supports managers in the workplace to look out for your staff, and their resources in Spanish as well. And then last but not least, we've been talking about children and the trauma and the time that it takes for healing. And there's a really good website called changingmindsnow.org. And there are 5 simple gestures that all of us as adults can do as caring adults in a child's life to help them heal. So I want to thank everyone for being with us for an hour, all of our panelists, UDC, SF, WPC, and we'll see you soon via email with the follow-up resources. So thank you so much. Stay safe, everyone.